So let's go to drugs working on the central nervous systems, or we can say CNS. So this chapter will not confuse with like we're talking about before automatically nervous systems. So the category, like the whole nervous systems, we separate with CNS and PNS first, peripheral nervous systems, and CNS. So CNS, including cranial nerves, including the brain. Including the brain and the spinal cord. So that's the CNS part. PNS part, including the cranial nerves. That's 12 pairs in there. And the spinal nerves. And 31 pairs in there. In PNS part, we say some nervous bunch directly control the skeletal muscles. And some nervous bunch, they control the organs. Maybe some grass. So control the organs part. That's we call automatically nervous systems. So that's including sympathetic nervous system and parasympathetic nervous system. So that's the class we're talking about the drugs control ANS before. Today, we're especially talking about the drugs on central nervous systems. Don't confuse it. Yeah, don't confuse it. So on CNS part, we say they will located in the brain and the spinal cord, but truly mainly working for the brain. Yeah, mainly working for the brain. So that's we talking for today. Drugs working for CNS. We know nervous cells, like they send the signal from one nervous cell to another cells. Basically, like nervous cells, they have nerve bodies. And then axons, yeah, maybe pretty long, maybe not that long, but that's the way connected with another nerve cell, ending part of axon. And they have a space here, not. So basically, nervous systems mainly function and connected by the transmitters, nervous transmitters. That's we talking about before in ANS. The same thing happens in CNS. They still cell and cell connected each other. They still have mainly transmitter kind of information there. So in the CNS transmitters, some transmitters are exactly the same like we talking about before, they also working in ANIs. Like we talking about adrenaline, noradrenaline, and we talking about ACH. They are both as transmitter in ANIs, and they also as a transmitter in CNIs. We have some other special transmitters. It mainly working in the CNIs. Dopamine and 5-HT. So these two transmitters mainly working for CNIs. We only list 4 CNS transmitters here, but truly more than 4. That's just the mainly transmitter and perform the mainly functions. So that's we list 4 in here. When we're talking about the CNS functions, we may thinking about people like learning or memories or emotions or controlled sleep, controlled body temperature, have lot of functions directly relationship with CNS function, or in other words, directly relationship or brain function. Different transmitters, their function or their controlled function will be different. So brain or CNS is a pretty complicated system. So we just try to pick up some more important functions and how they control it. Certainly, brain's function is more complicated than we're talking about. But generally speaking, we're talking about noradrenaline first. So noradrenaline as a CNS transmitter. We're talking about CNS transmitter here. As a CNS transmitter, mainly control the mood, like people's emotions. So if these transmitter functionally deficiency, that's basically cause depression. So that's we're talking about people always like emotionally depressed. That's mainly is the transmitter noradrenaline function deficiency. And noradrenaline also control like some walking and alert. So basically we're talking about like spirit functions here. So that's basically noradrenaline. Then we talk about dopamine. That's a chemical's name. So dopamine mainly control like some motor functions. When we talking about motor functions, control the movement of the body. So we say CNS and PNS, they connected each other. we have like a motor function start from our brain and then through the spinal cord, go down and then go to our body, like the limbs control it. So it means like losing their functions. So that's pretty easily losing normal control for motor function, means movement function. For example, we have an illness name we call Parkinson's or Parkinson's syndrome. So that's basically caused by dopamine deficiency kind of condition. So the symptoms, if patient have this kind of illness, trauma on the limbs, maybe just on one side of hand, or maybe on one side of body, both hand and both feet, and maybe cause both sides, like limb trims. And truly clinically, some dopamine could be directly used for treat patients have this kind of symptoms. But Parkinson's still a pretty complicated illness. It's not only we give patients drugs like dopamine, it's truly totally controlled and maybe have some other troubles also. But that's one of the reasons in there. And dopamine is also affected with other aspects, like people's behavior, mentals. With dopamine is so important, like motor control there. Truly, we can give patients dopamine to treat. But if too much, maybe cause the other problems, cause some mental disorders, like mental confusion or maybe crazy kind of situations. And also relationship with some hormone release. So dopamine is truly inside of our brain perform pretty complicated action there. Like some actions we still totally understanding why caused. Like sometimes even cause patients nausea and vomiting. But whatever we need to know, dopamine is very, very important, like nervous transmitter in our brain. Then we talking about 5-HT. That's another chemicals, another important nervous transmitter inside of our brain. So this transmitter more close relationship with feeding behavior, like people sometimes more even more hungry or even eating more, try to eating more. And also kind of relationship with some kind of behavior, relationship with like mental things. For example, like people got mental disorders, like always see something but not truly in there. Like some people say, I saw a cat in my room, and sometimes go to the floor, sometimes go to the walls, and sometimes go to my desk. But in the family, no other people see something in it. Yeah, nothing, truly nothing. Just mental confusing kind of disorder. And these transmitters also control the mood and the emotions. We're talking about we have one transmitter control the emotion before, like mood before, no adrenaline. But we say our brain function is so complicated. It's not only we talked about before, like a one-to-one kind of key and lock there. That's working for our immunity system, one-to-one, key and lock. But for our nervous system, everything connected each other. Yeah, we have a lot of cells, but one cells may be connected another, even more than 10 cells, and another cell connected another more than 10 cells. So it's pretty complicated, like a network systems inside of it. So we're talking about different transmitters will control the same thing, and they affected each other. And these transmitters, 5-HT, also control the body temperature. Like we say normal body temperature, we expected something around 36.5 to 37.3. That's usually normal range in there. And truly, the body temperature control in our brain, in the brain. And the transmitter especially control body temperature is 5-HT. So that's for this one, and also control the vomiting. Similar, when we talking about the topan, topan control people vomiting, and 5-HT also control the vomiting. Then we're talking about another nervous transmitter, ACH. ACH also the transmitter, pretty important transmitter in automatically nervous systems we talked about before. Like both in sympathetic nervous systems and parasympathetic nervous systems. They even control like skeletal muscles. So it's pretty important in our peripheral nervous systems. And it also the main transmitter in CNS. The functional relationship with people wake up, keep wake up, and also relationship people learning and short-term memory. So that's some transmitters functions by the doctor's study that we find right now. But still some functions not totally clear yet. So if these transmitters have some disorder, we're talking about in CNS, in our brain. So basically can cause people losing brain functions. So that's a pretty common illness for aging people, like mainly losing memories, especially like pretty recently memory, like people just got this kind of illness. Like something happens 20, 30 years ago, they still can remember. But something just happens, like take a key, try to open a lock, but he forgot what he want to do. So that's basically relationship with the transmitters, ACH, and also Parkinson. So you still see, when we're talking about dopamine, we're talking about Parkinson's. When we're talking about ACH, we're still talking about Parkinson's. So that's basically the transmitter in our CNS. So CNS disorder, we say certainly we have cells disorders, and we also have transmitters disorder. Generally speaking, like if some people have like injury or trauma happens in the brain, that will damage both cells function and certainly the transmitter's function will be damaged also. But if patient not truly have like a big injury or big trauma, or without truly we can see some shape change, for example, some tumor in the brain still damage the nerve cells, or cancer inside the brain. Or maybe some bleeding, bleeding truly still caused like shape and structure changing. But if some people like look like normal, whatever CT scan or MRI scan, nothing finding inside the brain, and looks normal, that's mainly caused by transmitter disorder. So that's about our CNIs and our medication, or drugs, mainly working for transmitter part. We are not truly working for the cells part. Cells part, nervous cells, basically they couldn't like recover by itself after injury. Like last semester, when we talking about cells injury and repaired. So we have two different kind of repaired way. One kind of repaired way, like you with the fabric. Another repaired way is totally repaired. So nervous cells repaired is not by itself. It repaired by the glial cell. So still remember, inside the nervous system, we have two kinds of nervous cells. One is nervous cells perform functions. Another is the glial cell. Glial cell is maintenance, repaired, but glial cells don't have special nervous functions. So that's basically if some people's nervous cells is injured, is truly totally recovered. So that's why, like people after brain stroke, like they wake up already, like a severe case, they lose consciousness. But after treatment, they wake up, they can talking, they can listen to people to speak, but they still like losing part of the body functions. It couldn't totally repair. Like one side of body is moving, losing part of function. Maybe totally couldn't move. Maybe they can move, but couldn't totally normally move. So that's basically brain stroke. Basically, we have two parts. One is blocking the blood flowing to the local brain. That's we call usually blood stasis in the blood vessels. Another pattern is bleeding. Blood coming out and cause some pressure to the brain cells. Still damage brain cells function. So that's basically happens in our brain. So our drugs not truly working for that part, for cells recover part. but all drugs mainly working for the nervous transmitter part. Then we go to our drugs part. So before we go to drugs part, we still go to a radio to see some general information in this part. Then we come back.
Drugs acting on the central nervous system. CNS and function. The central nervous system, CNS, controls most functions of the body and mind. It consists of two parts, the brain and the spinal cord. The brain is the center of our thoughts, the interpreter of our external environment, and the origin of control over body movement. Like a central computer, it interprets information from our eyes, sight, ears, sound, nose, smell, tongue, taste, and skin, touch, as well as from internal organs such as the stomach. The spinal cord is the highway for communication between the body and the brain. When the spinal cord is injured, the exchange of information between the brain and other parts of the body is disrupted. To treat CNS disease, some CNS neurotransmitters could be used as drugs. The main CNS neurotransmitters are noradrenaline, dopamine, 5-hydroxytryptamine, 5-HT, and acetylcholine, ACH. Norepinephrine, also called noradrenaline, is a neurotransmitter in both the peripheral and central nervous systems. Norepinephrine produces many effects in the body, the most notable being those associated with the fight or flight response to perceived danger. In CNS, noradrenergic transmission is important in control of mood, functional deficiency resulting depression, controlling wakefulness and alertness. Dopamine functions as a neurotransmitter in the brain. Dopaminergic signaling is associated with reward-motivated behavior and motor control with dysfunction of the dopamine system leading to numerous diseases. Dopamine is important in motor control. Parkinsonism is due to dopamine deficiency. Has behavioral effects. Excessive dopamine activity is implicated in schizophrenia. Important in hormone release. Prolactin, GH, and dopamine in chemoreceptor trigger zone causes nausea and vomiting. 5-hydroxytryptamine, 5-HT, serotonin, acts as a neurotransmitter within the central nervous system, CNS, and peripheral nervous system, in addition to mediating non-neuronal actions in numerous other tissues including the gastrointestinal tract and blood vessels. As CNS neurotransmitters 5-HT feeding behavior, behavioral response, hallucinatory behavior, control of mood and emotion, control of body temperature and vomiting. Acetylcholine is the neurotransmitter used at the neuromuscular junction. In other words, it is the chemical that motor neurons of the nervous system release in order to activate muscles. As CNS neurotransmitters, ACH has effects on arousal, on learning, and on short-term memory. Dementia and Parkinsonism are associated with abnormalities in cholinergic pathways. Acetylcholine is also a neurotransmitter in the autonomic nervous system, both as an internal transmitter for the sympathetic nervous system, and as the final product released by the parasympathetic nervous system. Acetylcholine is the primary neurotransmitter of the parasympathetic nervous system. General anesthetics, or anesthetics, see spelling differences, are often defined as compounds that induce a loss of consciousness in humans or loss of writing reflex in animals. Clinical definitions are also extended to include an induced coma that causes lack of awareness to painful stimuli, sufficient to facilitate surgical applications in clinical and veterinary practice. General anesthetics do not act as analgesics and should also not be confused with sedatives. General anesthetics are a structurally diverse group of compounds whose mechanisms encompasses multiple biological targets involved in the control of neuronal pathways. General anesthesia involves the physiological changes: reversible loss of response to painful stimuli, loss of consciousness, and loss of motor and autonomic reflexes. General anesthetics are administered by inhalation or by intravenous routes. They are classified into two on the basis of their route of administration, as inhalation and intravenous anesthetics. Sedative and hypnotic drugs are more commonly used clinically. Sedative hypnotics are a class of drugs that cause a dose-dependent depression of the CNS function, inducing sedation, sleep, and unconsciousness with increasing dose. Agents in this class of drugs include benzodiazepines, barbiturates, and melatonin agonists. Clinical uses for insomnia, anxiety, preoperative mediations, acute alcohol withdrawal, as anticonvulsants, chronic muscle spasm and spasticity. Parkinsonism. Parkinsonism is a clinical syndrome characterized by tremor, bradykinesia, rigidity, and postural instability. A wide range of causes may lead to this set of symptoms, including neurodegenerative conditions, drugs, toxins, metabolic diseases, and neurological conditions other than Parkinsonism. About 7% of people with Parkinsonism develop symptoms as a result of side effects of medications, mainly neuroleptic antipsychotics. Parkinsonism is characterized by a combination of rigidity, bradykinesia, tremor, and postural instability. It is due to the imbalance between the cholinergic and dopaminergic influences on the basal ganglia. Thus, the aim of the treatment is either to increase dopaminergic activity by dopamine agonist or to decrease cholinergic and to muscarinic drugs' influence on the basal ganglia. Psychosis is an abnormal condition of the mind that results in difficulties determining what is real and what is not real. Symptoms may include delusions and hallucinations. Other symptoms may include incoherent speech and behavior that is inappropriate for the situation. There may also be sleep problems, social withdrawal, lack of motivation, and difficulties carrying out daily activities. Psychosis has many different causes. These include mental illness, such as schizophrenia or bipolar disorder, sleep deprivation, some medical conditions, certain medications, and drugs such as alcohol or cannabis. One type, known as postpartum psychosis, can occur after giving birth. The neurotransmitter dopamine is believed to play a role. Acute psychosis is considered primary if it results from a psychiatric condition and secondary if it is caused by a medical condition. The diagnosis of a mental illness requires excluding other potential causes. Testing may be done to check for central nervous system diseases, toxins, or other health problems as a cause. Antipsychotic agents. Antipsychotics, also known as neuroleptics, are a class of medication primarily used to manage psychosis, including delusions, hallucinations, paranoia or disordered thought, principally in schizophrenia but also in a range of other psychotic disorders. Most antipsychotic drugs are readily but incompletely absorbed. Many of these drugs undergo significant first-pass metabolism. Very little of any of these drugs is excreted unchanged. Adverse reactions. Extrapyramidal reactions as Parkinsonism. Seizures. Autonomic nervous system effects and muscarinic effects, increase heart rate, muscle relax, orthostatic hypotension. Metabolic and endocrine effects, weight gain, infertility, loss of libido, and impotence. Drug dependence and drug abuse. Addiction is defined as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. Those changes may last a long time after a person has stopped taking drugs. Addiction is a lot like other diseases, such as heart disease. Both disrupt the normal, healthy functioning of an organ in the body, both have serious harmful effects, and both are, in many cases, preventable and treatable. If left untreated, they can last a lifetime and may lead to death. This is about drugs acting on the central nervous system.
So last video tells us some generally some common used drugs in CNS. The firstly, we're talking about a special category of the drugs. So these drugs basically we use people for surgery. It's not truly like people daily life use these kind of drugs. So basically, when people go to surgery, and then we use these, that's still a category drugs there. When we're talking about generally here, means like go to all over the body. Yeah, it's not locally used. We have some locally used, but here we're talking about general. General means like go to all over the bodies. And after people use this category of drugs, usually people like don't feel the pain. Yeah, don't feel the pain. Stimulations, yeah, not response. And most people losing consciousness. And certainly they losing movement function and losing some reflections functions. So that's basically because we use these category drugs when we do operations, like people will not feel pain anymore, even they couldn't feel anything. And after surgery, they can recover. So that's a reversible kind of losing function there. That is a special kind of situation we need to use. So these drugs truly working for our CNS symptoms, working to the brain. So use these kind of drugs, we can do two ways. One way is inhalation, means by the breathing. Another way is injections. Usually injection directly to blood circulations. Inhalations basically like people lay down there, and like when people ready to operations, people will lay down there and put a mask. Yeah, put a mask over the mouth, over the nose, and a tube coming out from the mask and connected with a machine, and some special kind of gas will through this tube and go to inside the mask, and then people will inhale. Yeah, inhale. So that's some medication we can use like this way. So inhalation kind of drugs. So we have some drugs. Yeah, that's just the chemical's name, and that is mostly pretty commonly used. Yeah, and pretty easily used. We say any kind of drugs, basically they will have some side effects. So this one, yeah, is easy to use, easy absorptions, but they may cause some side effects. They may cause the heart rate irregularly, and they also possibly cause some liver damage. So that's this one. And we have another one. Another one, still kind of gas, yeah, still kind of gas, still can inhalation, yeah, still can inhalation. And generally say they don't have special kind of smell, and they even don't have color, and pretty rapidly perform the actions. So look like a pretty effective, yeah, pretty effective, yeah. But the actions is not that stronger. Another name for these drugs, people call it the gas can cause people laughing. Means if we are not inhaling enough, people maybe not like or expected like lose confidence or couldn't feel pain. They may just laughing. Yeah. Chinese is 笑气. So that means maybe we need a combination with others used together. Otherwise, maybe not stronger enough, but it is a good drug we can use. And they don't have severe kind of side effect, so that's good. And the third kind, so it is, we say, mostly drugs will go to metabolism in the liver. That cause the liver some issue. Means liver need overworking there. But these drugs is less metabolism in the liver. So that means less toxins to the liver. So that's especially for this one. And faster actions, still good. That's still good. So that's another category we can use. And we have another fourth category. That's mainly kind of combination, like people lose confidence and make muscles relax at the same time. But they still have some other side effects, like they can cause respiration tract irritation. Just means more reaction in there because we inhaling these kind of drugs, and then maybe cause people like a cough, and also possible cause patient later on some nausea or vomiting. So truly this category is not that commonly used right now. But we do have 4 category kind of drugs, especially through our respiration tract, inhaling and got infections. So that looks like more convenient. Yeah, more convenient. People just inhaling and then got the actions. We say another category is injection to the blood vessels, basically injection to the vein. They are not most drugs we injection to the vein. Yeah, not many drugs injection to the artery, because we can think about our blood circulations. Our blood circulation we're talking about. We separate from the heart part, left side heart and right side heart. Left side heart pump blood coming out to the artery. Then the artery go all over the body, go to the tissue. In the tissue area, we have capillaries there, like network there. And then from the capillary, form our vein, small vein and a big vein, and finally go back to our right side of the heart. So our injections to the vein, basically we have 2 reasons. One reason, the vein is more superficial. It's much easily injection go to the vein. Like we can see on the superficial, we have a lot of veins. Like a dark blue color, that's the vein. and the artery truly go to deeper. It's not that easily to find. And also artery, remember, pressure is high. That's another reason it's not that easily to injection to the artery. But the vein is more superficial and more easily, less pressure, go to injection. And also the better circulation. The circulation will go to the vein, they directly return back to the heart, and from the heart sending all over the body. But if we inject into the artery, they will send into the local tissue first, and then coming back from the vein, and then sending all over the body. So that's another reason. So when we're talking about injections, drugs, mainly injection to the vein. Truly, we have some special kind of medication, possible go to the artery, but mainly go to the vein. Injection kind of drugs go to the blood vessels. Reaction is pretty rapidly. And after use the drugs, people maybe lose consciousness about 20 seconds. How faster it is. And with the injection to the vein and blood circulation, sending the medication go to the brain pretty fast, and then people losing consciousness. Then we can perform our surgery. So that's compared with inhaling, that's more faster and more effective. So that's clinically still pretty commonly used. But like some other medications also, like if we directly inject into the vein, maybe cause more side infections. So that's another issue. Then we go to another category of the drugs. Another category drugs basically help patients calming down and help people to sleep. So sometimes people come into clinic, they complain, they say hard to fall asleep and busy mind. Yeah. So that's the issue, and we can use this category of the drugs. So this category of the drugs basically by their chemical structures we separate with 3 groups. So that's the first group. Yeah. The name here is the group's name. It's not a single drug's name. It's a group's name. It's pretty important, yeah, pretty commonly used, and calming the mind and help people to sleep. And the second group, barbiturates, barbiturates group. We have a lot of drugs in this group also. Originally, this group even more commonly used, but right now it's less commonly used. It's not that commonly used because we have some new drugs. And the third group, we're talking about beta adrenaline kind of group. We're talking about the treat circulation issue. We're talking about these kind of drugs before. They block there and decrease some reactions. So that's basically we still can use for calming and help sleep. like relieve some kind of anxiety. So that's basically in this category, we have 3 different groups of the drugs. But this, like a beta blocker there, is not truly not effective to help people sleep. It's just like calming the mind, relieve some anxiety. So this group we put together, clinically use, certainly help people sleep, treat insomnia, treat insomnia. So basically treat the patient's situation. Difficult fell asleep. Difficult fell asleep. So like people hard to fall asleep, then use this category of the medication. And also can treat anxiety. People always anxiety. And prepare for the operations. People very stressed. And we can give patients this category of the drugs. Then they can more relax. And also can help people drinking alcohol. Like people addiction to alcohol, they try to stop to drinking. But we will talking about like addictions. That's still kind of mental disorder. When people try to stop drinking, they will cause a lot of symptoms. So in this kind of case, we can help people use this category of the drug, relieve some symptoms. And anticonvulsions, and chronic muscle spasm, still like calming the spread and then relieve the muscles. And we say any kind of drugs, they may have some side effects or don't wanted infections. So in this category drugs, we try to make people coming down and try to help people to sleep, but truly if overuse it, maybe cause people sleep too much. And also, even like we use the normal dosage, even we use normal dosage, normal treatment, still can cause the people sleepy, and mental confusing, and poor memories, and even some like movement functions be like damaged. So that's another side infections. And everybody's like tolerance for the drugs will be different. So that side infection happens in the different people may be different. So we need watching for everybody independent situations. If severe kind of side effect happens, we need to stop for treatment. So that's basically in this category. And then we go to another category. So another category, we're talking about Parkinson's. So Parkinson's, like we pretty common hear the name, is kind of movement disorder. Like people always have some troubling, or even some mainly is troubling, but also can feel like hard to moving the limbs and slow movement like later on, but mainly is troubling. So when we're talking about transmitters before, we say that's mainly relationship with the transmitters, ACH and dopamine. It's kind of balance. Yeah, it's kind of balance there. So either of them have trouble will cause the Parkinson's syndromes. So basically, clinically, we treat these kind of problems. We give patient some dopamine kind of medication, making it more effective. And we need to control or decrease ACH. So that's basically we're working for Parkinson's. Then we go to another category of the drugs, mental disorder. Like people, pretty crazy. They always thinking about something not truly happens. They even can can see something not happens, can hear something not truly happens. That's a severe kind of mental disorder. So these disorders, these disorders basically is particularly severe kind of situation. It's not like generally like people depressed or not generally like some emotions. They truly crazy. So we have a lot of drugs in this category can working for these kind of situations. So basically, depending how severe of the situation, we can combination use different kind of medications. Some medications may be pretty mild. Even people use it, it's not cause severe kind of problems. I think that one you may heard about it. And some of them is pretty strong. If we abuse, maybe cause severe kind of problems. So that's basically in this category. The absorptions in this category, the drugs is not truly absorptions, and still we need thinking about the patient's special conditions, and usually we start from small dosage and then to see the patient's reactions. So these categories of drugs, we only use two kind of conditions. One condition, just like we talked about before, people mental disorder, mental confusing, and always thinking about something not truly happens. They can see something not truly in there. They can hear something, not people truly say something. So that's mental disorder. But basically in this category, the people will be quiet. Yeah. It's not like make a noise or crazy for others. Just itself have some trouble there. Always thinking some people try to kill him or whatever. They are not damaged for others. But second category is crazy kind of people. When they're crazy, they try to kill others. Yeah. So that's even more severe kind of situation. So basically, these kind of patients need to send into special hospital to treating. But the first category, sometimes they treat in the home. So we say any kind of drugs, they may have some adverse reactions, and especially for these kind of drugs, especially working for the mental disorders, they also have some other side functions. We say some movement disorder, pretty similar like a Parkinson or cause Parkinson, and muscle spasm or seizures, and also some other infections that look like autonomic nervous system infections, like changing the heart rate and muscle relaxing and hypertension, so some infection, and also metabolism and endocrine infections, like getting body weight and losing some sex functions. So that's the side infections relationship. So when we're talking about antidepressant, antidepressant. So depressed still belong to the mental disorder. Yeah. It's more commonly disorder, antidepressant. The medication we use, the antidepressant, is different when we're talking about the last category. The last category is even more severe, even more severe. But depressed still belong to mental disorders. So this category drug is even more commonly used. So basically by their chemicals structure, we have different drugs. So that's mainly the patient have depressed, go to family doctor, they may give you some of the drugs belong to different chemicals and different category drugs. So most drugs after taking is not like 100% to absorptions, and they mainly go to metabolism, and changing in the liver. Clinical indications for this kind of drug, certainly depressed. Depressed, that's mainly got this kind of drugs. And also can use for panic attack. So I have a patient before, her husband suddenly died because of a car accident, and then she got a panic attack. So like scared for everything, couldn't sleep, and certainly mental, some confusing, and she got some medication for like panic attacking. So that's basically we use. And another situation, people always scared for something. And even we can use for children for waking back. Means when children sleep, sometimes they get in urine and during the sleep. They don't know. So that's pretty commonly happens in the children. So we still can use this category of the drugs. And another category here, that's different category, just different chemicals. We use for pretty hard to treat kind of depressed or other treatment not totally cured. So that's different category drugs we use for different kind of situation. Then we're talking about side infection or advanced infection. So this category of the drugs pretty easily caused hypertension, low blood pressure. When people changing the position, like from lay down to sit up, from sit up to get up. So that's a pretty common issue. And also maybe cause the dry mouth. Yeah, dry mouth, dry tongue, dry throat. And possible cause of abrasion. And constipation. Like some body fluid disorder, not circulation properly. And urine retention. They hold the urine, hard to be out. And some others. So that's and also for this category of the drugs, also possible getting weight. So if patient coming to oral acupuncture treatment and they have some similar reaction in there, you can ask the patient if they use some medication. If they use this category of the medication, truly there's some side effect coming from the medications. Finally, we're talking about drugs depending and the drugs abuse. Like we're talking about a lot of drugs already. All the drugs, they will have some side effects. And also, most drugs after use, they will cause patient kind of addiction. Like people use sleeping pills for 1 year or 2 years. They truly couldn't stop. If they stop, like they will like palpitations or even depressed, couldn't do anything. So lot of side effects. So that's we should be careful, like when people use the drugs, try not to cause too many side effects. So that means we try not to abuse the drugs. Use the drugs only necessary. And if can stop, just try to stop use. Yeah. If use long term, truly cause lots of problems. Certainly, we only give some patients some suggestions, and they need to go to their family doctors truly get a decision and to see what kind of drugs. But truly, basically, in my clinical treatment, I will not directly tell the patient stop use drugs, whatever kind of drugs. Like we need to tell the patient go to the family doctor to talk to. But truly, like people with painkiller, for long term and after acupuncture treatment, getting better, we can tell them talking with your family doctor to see if you can reduce some medication because you're getting better right now. Or maybe patient coming with hypertension and blood pressure getting driven down, and similar situation with other issues. We can suggest the patient to talking with their family doctor, but try not to directly talking with the patient to stop use the medications. So that's basically in these chapters. Any questions?